Hi, I'm Kristen Goodwin. On this episode of the Fox News Rundown, prolonged isolation amid the coronavirus pandemic taking a toll on many Americans, and it's proving to have a devastating effect on young people's mental health. Superintendent of Nevada's Clark County School District, Dr. Jesus Jara, opens up about the county's push to partially reopen schools in response to a rise in students taking their own lives. And the Biden administration working to buy 200 million more COVID-19 vaccine doses, but public health experts still anticipate a tough road ahead. Dr. Marty McCary, a professor of surgery and health policy at Johns Hopkins University and a Fox News medical contributor, breaks down concerns over the vaccine rollout, different strains of the virus, and the effectiveness of restrictions being enforced across the country. Plus commentary from Fox News legal analyst Greg Jarrett. The Fox News Rundown is a daily news podcast where we take a deeper look at the stories important to you. You can subscribe on your favorite podcast player by going to foxnewspodcast.com.
Lee Campagno.
I'm Guy Benson.
I'm Shannon Bream, and this is the Fox News Rundown.
Wednesday, January 27th, 2021. I'm Lisa Brady. There's a national debate about fully reopening schools in a pandemic. But one Nevada district is on a mission, concerned it's costing lives to keep them closed.
These are children who are struggling, and we have to continue to find ways to help them.
I'm Dave Anthony. The push to pick up the pace of COVID vaccinations comes amid worry about virus variants.
Given the rate of new mutations and these new strains that are emerging, are we going to be able to keep up? At some point, is it going to mutate around the vaccine? And that's a very real and serious question. And the answer is maybe at some point.
And I'm Greg Jara. I've got the final word on the Fox News Rundown.
One of the biggest challenges on the way out of the pandemic is when and how to get kids back in school. Across the country, there's a patchwork of in-person or remote learning, and in many areas, still a hybrid of the two.
I think that President Biden's goal is really important.
The president wants a majority of K through 8 schools reopen in his first 100 days. And Randy Weingarten, president of the American Federation of Teachers, says that can be a real goal unless new strains of COVID interfere. But it's also not clear when more federal funding might arrive to help with expanded safety measures like testing and ventilation systems. And some teachers aren't satisfied with existing safety plans.
If you're trying to force us back into the building, give us a real plan, a schedule, a link to get tested.
Linda Perales teaches in Chicago, where the union wants all teachers vaccinated before in-person learning resumes. But the nation's third largest district has argued that some families can't wait any longer. While the risk of COVID transmission in school is considered low, there's been growing concern about the risk of other problems for kids who aren't learning in person, from falling grades and social interaction setbacks to mental health issues, even suicide. In the nation's 5th largest school district, which includes Las Vegas, 18 students took their own lives between last March and December, the youngest just 9 years old. That was double the number from the previous year, though there's no proven link to school closures.
They have been troubling as a school system and as a community.
Dr. Jesus Jara is the Clark County superintendent.
It's something that I am extremely concerned, and our kids, are struggling emotionally. I say this quite often. It's hard for adults to deal with a global pandemic that we've never dealt with, and that's when I started thinking about the challenge that teenagers and children are probably facing as the economy shutting down everything that we've known, and that's part of where we started trying to find ways to bring solutions and support our kids who are struggling. But yeah, you're right. I can't conclusively link it, but I have a strong feeling that the isolation that's happening in for our kids, for our children, has a lot to do with their mental health well-being.
Well, and when you have the number of suicides doubling over 9 months compared to the year before, what's different about that 9 months? Well, the pandemic.
Correct, the pandemic, which that's exactly the biggest concern that we have, and no explanation, which has caused the economic crisis. You know, when you see your parents struggling, when your number one industry in Las Vegas and Clark County is hotel and casinos, that's one of the things that you see the challenges that my families are facing at home, and how do we deal with that, and children having to grow up quickly, and not having an outlet to be able to come to school, to find normalcy in their life, play athletics, the band, the choir, some of the what my kids were facing or using as a tool to escape, it's all gone.
I know before the pandemic, youth suicide rates in the country had been on the rise for a decade. What are some of the things that your district has been doing to try to address that issue?
Yeah, that's a great question. One of the things that we started, obviously increasing the support from the state grants on mental health, bringing social workers, even though we don't have enough, right? I mean, in public education, there's a lot of resources that are lacking, but the state had made an investment on mental health support for kids, for schools. When we started this pandemic, when we started, with the closure and the not connecting to our kids, not finding them, we retooled our staffing. We moved our truancy officers from truancy officers checking on kids. For truancy was more checking on kids for wellness, checking on that they were home, that they were connecting with our schools. So we've made some drastic investments in the last seven to 8 months.
Mm-hmm. And I know teachers were trained as well to start being able to spot the cues of trauma on screen as opposed to in person. But then by the summertime, there had been so many suicides that a new program was launched, right? I think it's called the Go Guardian Beacon Alert System, which sends out alerts when it's thought that there's a suicide risk.
Yeah, let me tell you a little bit about that works. I mean, that was added to our Chromebooks that we purchased, and it was really through artificial intelligence, where kids are Googling or surfing, how to harm themselves. It sends my executive team and our police department an alert, and then it alerts, whether it's we have our own police department, or our municipalities are alerted, and then they go home and do a wellness check. We have been able to get at least to one or two or a couple where, obviously where they were in the middle of the act. And I think that's been, where you find that some of the things that we are putting in place to provide that support for our kids who are struggling to be able to help the families.
Wow. I mean, a child may not always spell it out that they're about to attempt something, but through that system, I'm sure there are certain words that are red flags or phrases, and then the alert goes out. Were you surprised by how many alerts started coming in from that computerized system?
It's shocking. I get I get maybe about 5-6 a day on average, and in the middle of the night, where as I continue, I've kind of had to put my phone aside, really. Because they come in nightly, and it is shocking, it is surprising that, but we're not going to stop. We're going to continue to do what we can. Our social workers, our psychologists, our counselors are doing everything they can. These are children who are struggling, and we have to continue to find ways to help them.
What else do you think could help identify students who may be at risk? And are there ways that the state or federal governments can do more to help with that?
Right now it's we need to talk about it. I mean, one of the parents that I spoke to, it's something that's a taboo. It's not discussed. And I think awareness is one, because you don't know. I mean, one of the parents didn't know, honor student. And I think this is going to be, we don't know the effects of all of this. Academically, we know we're falling behind with the world pandemic that we're dealing with. Now it's emotional. We don't know what the future impact. So the federal government has to really invest in mental health. And I've had that conversations with our congressional leaders because these are going to have long-term effects on our families, on our kids, and our employees. There's days that I struggle.
Yeah, there's there's a lot of struggle to go around, right?
Yeah.
And it's definitely complicated, especially where the kids are concerned.
Mm-hmm.
I have two, so thinking about my own kids, a middle schooler and a high schooler, I get emotional because it really is difficult on so many levels. But when it comes to reopening schools, I mean, the president has certainly proposed more money to help with that, but how do you do it? Like, what needs to actually change to get people feeling safe going into schools? I'm sure your district, and many districts with hybrid models in place have already had safety measures to have students there and have staff there on a limited basis. So what is it that needs to be done to actually get, everyone back in the building safely?
I think right now, you're right. I think the hybrid model that we're looking at for pre-K3 is going to help. It's going to see where you start seeing the light at the end of the tunnel. I think the vaccine is going to be critical to be able to vaccinate where there's that level of safety and assurance as an adult that there's a mitigating effort for me to be vaccinated, to have that immunity, right? We're also, part of our opening plan has COVID testing for our employees, where there's that level of assurance as well.
What about families who may not want their kids back in school? If there's someone who's high risk at home, for instance, high risk for COVID complications, but then worries that their child might be punished if they don't go back to school when everybody goes back. What can be done for those families? There's going to be those families. There's going to be those educators. So we need to find a way to offer that choice and that option for families. And we have a plan to do that. That's part of where my opening for pre-K3 is for those who want to come. So if you as a kid, because your family says no, then we're going to continue with distance education for you. But that's going to be an option. And we're moving into having that opportunity for all the kids that want to stay home for whatever reason and offering that choice. But your thrust right now, the big picture for you is an urgent desire, if you will, an urgent plan to get as many kids back in schools as quickly as possible. Is that right? Yeah, my urge is I have a sense of urgency to start moving into face-to-face instruction for pre-K3 as soon as we can. What about the later elementary grades, the middle schoolers, the high schoolers? Is that a fall situation, or could it be before the end of this school year? No, I'm hoping that, obviously I'm going slow, right? I'd rather go slow and move forward and then start moving into as soon as I can, then go back to we're going to try it out with a small group, and then we're going to then continue and start seeing where everybody sees that that is safe. We can then start opening up some, our fourth and fifth and our middle schools, and hopefully get to our high schools by the end of the year if I can get there. When we finally do turn a corner in this pandemic, are you hopeful that more attention will still be paid to the issue of mental health and making sure kids who need it get help? Absolutely. I hope that this conversation is not just now. This is a conversation that we need to have in the near future, and it's a long conversation. We need to invest. Our kids, and I'll tell you, our adults, I'm not going to say that our teachers need support as well, all our educators. We all do, and I think that's the piece, that's the investment that we need to make in this country. The mental health of our children is a top priority. If you don't feel that you're safe to learn, then how could we expect you to learn how to read and do math and arithmetic? Well, thanks for all you do for the kids. The Clark County Superintendent, Dr. Jesus Jara, thank you very much for your time. We appreciate it. Thank you so much. The National Suicide Prevention Lifeline is available 24 hours a day. That number is 1-800-273-8255.
This is Greg Jara with your Fox News commentary coming up.
We could never have imagined this 1 year ago. The coronavirus pandemic has now topped 100 million cases around the world, and that's just the number of people confirmed to have had it. Total infections may be a lot higher. Of course, now we have vaccines, and President Biden is upping the ante on his pledge for 100 million shots in his first 100 days.
I think we may be able to get that to 1.5 million a day rather than 1 million a day.
Though there have been issues with that. The director of the CDC said the other day she's not sure how much supply there is, and distribution's been uneven, better in some places than others. White House Press Secretary Jen Psaki says a priority is
ensuring that states have the number of vaccinators they need. So that means people who are literally taking the shots and qualified to put them in the arms of Americans. And some states and some communities don't have people who are able to do that. And vaccine centers and places where people can go.
And when those issues are worked out, Biden advisor Dr. Anthony Fauci tells Fox,
by the time you get to April, you will have gotten to the point where I refer to it for simplicity as open season,
when we all might be able to get on that list to get a dose. Back now to the president's goal.
We actually hit 1.5 million vaccines per day last Friday.
Dr. Marty McCary is professor of surgery and health policy at Johns Hopkins and a Fox News contributor.
Weekends tend to be lower, so if you take a 7-day moving average, we're not quite at that rate yet. But 2 days into Biden's presidency, we hit 1 million vaccinations per day. Now, look, it should be higher. We're about 3 weeks behind schedule from the original stated goal of getting 20 million people vaccinated by the end of last calendar year. That's, a tragedy, but we're actually humming right now. And I think what the folks in the Biden administration are learning is that once the railroad tracks are laid, this train can speed along pretty quickly. And that's where we are right now.
But there have been discrepancies state by state. Some places it's hard to find vaccine. Other places there's a ton of supply and people are getting it real fast. So what do we do about that?
Yeah, this was a real disappointment, Dave. So the CDC came out with their guidance so late. They had 9 months to work on it, and they came out with their guidance 2 weeks after the vaccine was authorized and distributed. So states were in this decision paralysis. Hospitals were sitting around. Everyone was telling me, oh, we're just waiting for the guidance. We, need to wait and see what we're supposed to do. It was so complicated. The tiering structure was so convoluted. We should just be going by age. That is the simple strategy that allows us to vaccinate the most amount of people in a streamlined fashion that people can understand, which is important when it comes to implementation. So we need to go down the age ladder and hit the 40 to 50 million Americans who are willing to take the vaccine, who are over age 65. That's where 80% of the deaths are, and people over 65. That's who we really got to hit right now with the vaccine. Very doable. The next 40 million doses should go to them if they haven't gotten it already. Heck, Israel's already vaccinated 44% of their entire population. So we should be using the age-based system.
Now, my father-in-law is in New Hampshire. He's on the list for next week. He's going to get his first dose of vaccine. A question is, how long before immunity starts to kick in for someone? And then after that, will they still need to wear masks? Does my father-in-law, do all these people who've already gotten these COVID vaccine doses, do they need to keep wearing masks?
Hold on to your mask. It's very difficult for any public business or event to have sort of two different policies. And so for now, given the low burden of masks, if we can keep wearing them for another 2 or 3 months, I think we're going to be in such a good place by April, Dave. Honestly, we're going to be in such a great place. Just look at the rate of decline of daily new cases. It takes about 10 to 14 days for that immunity to start kicking in. The immunity may be as good as 62% after 2 weeks, 80 to 90% after 3 or 4 weeks before you even get the second dose. Wow. And then the second dose will augment it a little further. So I think we should be maximizing the number of first doses out there before we go to the second dose. But either way, people should keep their mask on until we get beyond this very difficult next month.
Lately I've been hearing so many more people talk about double masks, wearing two. And then I've heard other people talk about, well, the problem with masking is not all masks are equal. Some people have lousy masks. Some people have great masks. So should we be wearing two?
Well, if you're really concerned and you're high risk, I think it's a good idea if your mask is a very low quality cloth mask. We know that the N95s are over 90% effective. The surgical masks, what we call a level 3 surgical mask, what I've actually been wearing most of my life, those are actually about 50 to 60% effective. And they do a good job in the operating room. But some people are wearing very cheap cloth masks that are very porous. And if you do, and you're really concerned, a second mask could be helpful. You know, Fauci said this like last week, and it created a big stir.
Right.
But it's kind of classic Fauci. You know, he's about 9 months late to the party. You know, this is stuff we knew a long time ago.
But we weren't talking about double masks back last year, too.
He wasn't even talking about masks at all in March and April.
The number of new coronavirus cases has declined recently, under 200,000 a day for almost 2 weeks in a row, the fewest COVID patients in hospitals since mid-December, and a drop in deaths. Some cities and states have eased or are considering easing restrictions. In California, Governor Gavin Newsom has lifted a stay-home order.
Restaurants can open for outdoor dining with modifications. Nail hair salons can open with modifications. Certain youth sports can resume for competition.
And there's no longer a nighttime curfew. So what does Dr. McCary think we should still consider restricting going forward?
I think in areas where there are active outbreaks, it is good to limit indoor density. And especially if the ventilation's not good, then those limitations need to be even higher. Now, look, I'll go to public areas and they'll have me sort of check out an area like, I've worked with some sports teams, professional sports teams, and they have great ventilation. They have super high ceilings. They have great HEPA filtration. There you can allow more people, especially if they're wearing masks, because it's almost like an outdoor environment. That's why bars have been targeted, is generally the ventilation's not great. It depends on the bar. We should probably also think the same of churches. They're not immune from these ventilation issues. But I think indoor gatherings, it never made sense to close beaches. It never made sense to close parks. We should have told people to get outside when we told them to stay at home, and just tell them to use the basic precautions of distancing.
We've had still for the last couple of months now Moderna and Pfizer only as the vaccines approved. Where are we in your view on Johnson & Johnson and AstraZeneca, which seem to be the closest in the pipeline coming next?
So Johnson & Johnson will likely get their authorization in 2 weeks, and that's really good news because it's a single dose, does not require a freezer chain and the supply distribution, and it's badly needed, and there's a supply ready to go. So I think we're going to hear good news about Johnson & Johnson. You know, any hour now, Dave, they're going to be announcing the results of their phase 3 trials, and we're going to hear a number like we did the 95% number with the other trials on how effective it is. Anything above 60, 70, 80 will be well received. So I think that's good. The other one, the Oxford AstraZeneca vaccine, that is a great American tragedy that it's not been authorized in the United States, and not even close. I mean, April's the earliest, and yet millions have been given out in Europe, and the UK have green-lighted it. And the tragedy is the FDA does not use rolling reviews. They don't look at data in real time. They're not using the data from the UK. They're insisting on another entire trial to be completed. And history will look back and judge us as a country, because many Americans have died because of the games that the FDA played with that Oxford vaccine. It's the easiest to distribute. We're having all these problems with distribution. That is the easiest to distribute vaccine ever made for coronavirus. It's like the flu shot. I mean, simple refrigeration lasts at least 6 months. No one has ever died from the vaccine. And the FDA just needs to get their act together and do their patriotic duty and give this a sound scientific review without cutting any corners, and do it fast. I mean, this game about, we'd like to see another trial before we authorize it. Well, just look at the 10 million people in Europe that have taken it. They're doing great. And that's our problem right now at the FDA.
There have been a lot of people focusing on these new strains from different places like the UK, a strain from South Africa, a strain from Brazil. Should we be worried about these? And if so, what should we worry about?
You know, there was a study that came out of the UK that showed that the variant they have is not just more contagious, it may actually be 30 to 40% more lethal, more dangerous. And, you know, folks were sort of dismissive of this idea that it could be more dangerous and said, oh, it's probably just more contagious. Well, guess what? If it binds more tightly to the ACE2 receptors in your lung, if you have more viral load because it's more sticky, then you're probably going to be sicker and probably have a higher mortality. And so we're realizing that. Now, the UK strain at the current rate of spread in the US could dominate by March, but I think we're going to see a massive deceleration before then and stem it off. The Brazilian strain is more concerning, and that's a little different from the South African strain. There's sort of three variants we're following: UK, South Africa, and then this Brazilian variant. And the Brazilian variant was just discovered in Missouri, and they reported somebody who was sick who tested positive. That person was sick back in the first week of January. So what does that tell you about how at large that strain is right now? And
so they're really spreading more, Doctor, they're spreading more than we think, or than we've had reports of, correct?
I think it's a mathematical certainty that all three strains are probably in every state in the union.
And then the vaccine. Do they cover them all?
Yeah, and so the vaccine will cover it. The vaccine will cover it. Now, we're not certain about the Brazilian strain. It's just the tests haven't been done yet. But the spike protein looks similar enough where it probably is covered. Now, the bigger question is, given the rate of new mutations and these new strains that are emerging, are we going to be able to keep up? At some point, is it going to mutate around the vaccine? And that's a very real and serious question. And the answer is maybe at some point. Maybe 3 years from now, 5 years from now, it could mutate around. We do see that with the seasonal flu every year. So we're going to be following this carefully, but Moderna has already started to do research to say that your second dose may be a little different so that it captures some of the newer variants. You can actually dial in into the vaccine a way to address the new variants.
Well, let's hope. Let's hope this light is coming at the end of that tunnel indeed. Dr. Marty Makary, Fox News contributor, professor of surgery and health policy at Johns Hopkins University. Thank you again for joining us.
Great to be with you, Dave.
From the Fox News Podcasts Network, subscribe and listen to the Trey Gowdy Podcast. Former federal prosecutor and four-term U.S. Congressman from South Carolina brings you a one-of-a-kind podcast. Subscribe and listen now by going to foxnewspodcasts.com. Rate and review the Fox News Rundown on Apple Podcasts or wherever you listen.
It's time for your Fox News commentary.
Greg Jarrett.
What's on your mind?
Here we go again. Let's call it Impeachment the sequel. It's destined to be as pitiable as the original. Like a cheap movie franchise that Hollywood keeps exploiting, this sham version will be the equivalent of a box office dud. The first impeachment trial in the U.S. Senate a year ago was a baseless fiasco that ended in the easy acquittal of Donald Trump. It's almost certain that the sequel will mimic the same bad ending. Pelosi and her colleagues didn't bother to abide by their own established rules that call for hearings, presentation of evidence and witnesses, the right to cross-examine those witnesses, the right of defense counsel to be present, and the right of an accused to mount his own defense. Republican senators are sure to assail the trampling of fundamental rights that are a cherished part of any trial process, including impeachment. This will be the subject of a motion to dismiss the impeachment, which should also argue that the Senate lacks jurisdiction to hold an impeachment trial of a private citizen who cannot be removed from office. Obviously, it's impossible to expel a person from an office he's already left. Take a moment to read Article 2 of the U.S. Constitution. It states the president shall be removed from office on impeachment and conviction. Trump is no longer president. Biden is. We have one president at a time. Some have argued that the value of a retroactive Senate impeachment trial is to bar Trump from holding future federal office. But read the Constitution. It indicates that disqualification from office is a secondary purpose. It's a separate vote. It can only happen after the Senate decides on removal. In other words, it's an optional, discretionary, and contingent penalty. Without removal, there can be no disqualification. It would be constitutionally invalid. If the motion to dismiss fails, and it probably will, Trump's defenders will be forced to argue the case based on the merits. Did Trump truly incite an insurrection? Take a look at what Trump said on January 6th to the crowd. Quote, "I know that everyone here will soon be marching over to the Capitol building to peacefully and patriotically make your voices heard." Nowhere in Trump's remarks did he advocate violence or destruction of property. Encouraging a public demonstration is not the same thing as inciting criminal acts. There's a big difference between rousing passions in a speech, all politicians do that, and inciting an insurrection. The violence on our nation's capital was grotesque and disgraceful. Those who committed the crimes must be prosecuted and punished. However, what happened there does not constitute grounds for impeaching Trump, nor should Congress be permitted to compound the tragedy by contorting the meaning of impeachment for political gain or persecution. It's time to end the politics of revenge. An assault on our seat of government should not give rise to an assault on our Constitution. I'm Greg Jara, Fox News.
You've been listening to the Fox News Rundown. Stay up to date by subscribing to this podcast at foxnewspodcasts.com. And for up-to-the-minute news, go to foxnews.com. Fox News Radio on demand on the Fox News app. Download the app and just click listen. When you swipe left, you can listen to your favorite Fox News talk shows live. Swipe right for the latest Fox News Radio newscasts on demand. Fox News Radio on the Fox News app. Download it today.
Love Fox News? Click the subscribe button to get more of the news and opinion you trust. And click the Fox News Rundown playlist for the latest episodes.